Hi, I'm Dr. Peter Zelles, talking to you for a second time, part two, about COVID and mental health. I spoke a couple weeks ago about starting to deal with some of the problems people are having with this, and it seemed like it was a good time to talk again. Today I want to talk about three things. Continue to talk about work, to talk about alcohol use a little bit, and also start to talk about panic because I'm noticing a lot of people are feeling more anxious with what's going on. Part of that might be sheltering in place, which a lot of states are doing right now. And it seems like it's worthwhile for us to talk a little bit about that. It's very easy during a time like this, when you're getting anxious, to start thinking in extremes and absolutes. And the kind of thinking that people start having at this point is that this is like torture, this is terrible, everything I do isn't working, all of us are going to get sick and die from this, or the economy is going to go down the tubes and never going to recover. A lot of people understandably are very worried about their jobs right now, and that certainly makes a lot of sense. But while we're doing that, one of the important things is to try not to panic. And panic is just a word we use for the idea that your anxiety starts to get out of control. And usually that means that you're thinking about these kind of absolute catastrophic thoughts that are really true, but in the moment, you can let yourself get very compelled by them, and it's hard to move away from them. And one of the things we think about this time is to try to start thinking something else. It's very hard to make yourself stop thinking, but it's much easier to start saying, I'm going to think another way about this, or I'm going to talk to myself differently about it. For example, one thing is really worthwhile is saying that we all have to adjust to a lot going on right now, and admitting that that's true. And we don't have to love it. We don't have to love it, but we do have to accept it, that that's the case. And when things are difficult or things are going difficult for us, it's important to acknowledge it, but also to say, this is temporary. Eventually, this is going to get better. Try to find some gratitude in your life about something you're feeling good about. Try to find things that comfort you. Uh, Even the technology that we're all a bit frustrated with right now is helping a lot of us to work. It's keeping a lot of things going for us financially, so we try to be grateful for those things as well. Perspective is the main thing. One of the things that changes is we lose our perspective during times like this, and it feels like it's never going to end. It is going to. During our worst moments, it's easy to get overwhelmed with this and think it's not going to, but it will. So try and keep that perspective going. The second thing I want to talk a little bit more about from last time was work. A lot of people are feeling very frustrated with working from home right now. That's a difficult thing to do. There's a lot of fear about working from home because a lot of people aren't quite as productive as they might be when they're at home. We're working with oftentimes computer connections that aren't as good as we have at work. Things might be slower. A lot of people are talking to me about feeling as though they're being judged at work about not working as hard as they should. So I want to talk a little bit about that. And one of those is try to talk with your supervisors about what's going on, what's going well and what's not going well. So if you're having a hard time with computer workup and hookups and so forth, uh, try to be clear with them about that, and also talk about the things that are going well, because those poor people are also hearing a lot of negative news all day, and it's nice to hear from an employee who says this is going well. So you let them know that you're trying. That's really important. Uh, Try to keep your boundaries with work. I talked about this last time, and this is still very, very, very important. Most of us aren't used to working from home, and one of the things that happens is the boundary blurs between work and home. If you've got your workstation at home all the time, it can feel kind of like you should always be working, and that's not true. So when I talked last time about trying to schedule some normalcy in your life, one of those is that you get up at your usual time, go through your usual morning routine, start work when you normally start work, and finish work when you normally finish work, so that you're not letting that boundary start to blur. Closing the book at the end of the day. Nobody ever finishes everything by 4 or 5 or 6 o'clock, so close the book, open the book the next day. That's really important to keep that boundary right there. One other thing with this is I'm finding some people are having a hard time with the idea of taking time off. You still need time off, even though you're home. Someone said to me the other day it didn't feel like it was right that they would take time off. After all, they're home all the time anyway. Taking time off and not working is different than working from home. So remember, you still need to have that time. Feel free to take it if it's available to you. You should use it. The third thing I want to talk briefly about just a little bit is alcohol. A lot of people have commented about the fact that in most states, the alcohol stores, the liquor stores are still open. And that was a very thoughtful and determined decision that was made for public health reasons. We have a lot of people who are addicted to alcohol. They're drinking a large amount every day. If we suddenly cut all of those folks off, they're going to flood the emergency rooms, coming in with really serious withdrawal symptoms, and we can't have that. So that's why the liquor stores are open. I realize that that's a comfort for the rest of us who may want to have a drink, but there is a bit of a problem in here. Uh, Alcohol is at record volume right now. People are really buying a lot of alcohol. Part of that might be a little bit of the kind of anxiety-driven hoarding behavior that humans do. It's just one of those things we do. But the other part of it is people may be drinking a little more than they normally would, and that's not necessarily a good thing. Those of us who work with anxiety know that anxiety is this problem that can be temporarily helped by alcohol, but not long-term. So if you have a drink or so, you might find yourself feeling more relaxed. And of course, what sometimes happens then is you get kind of disinhibited and you might want to have a third or a fourth or a fifth, and that is a problem. So be thoughtful about this. Aristotle famously said, moderation in all things. That's very, very true with this. You want to hold off on how much you drink. Think a little bit seriously about what is a drink. A unit of alcohol, as we call it in medicine, is 1.5 ounces of spirits, 12 ounces of regular beer, not high alcohol beer, or about 4 ounces of wine. That is a unit, and we probably shouldn't be having more than 2 of those a day. We try and keep them under 14 a week. That doesn't mean you get to have all 14 at once. I mean, you spread that out during the week if you're going to have that much. So hold back on that. Be careful. We don't want a lot of people ending up with alcohol use problems at the end of all this, and that's certainly a possibility. So just keep yourself reined in a little bit. It'll be better for you in the long run. Take good care of yourself. Be kind to each other. That's terrifically important during this time. Stay safe. I look forward to talking to you again.